Health Beat with Dr. Benita Zahn.
Welcome to this special edition of Health Beat. I'm Benita Zahn. Since the start of the pandemic, we've been bringing you conversations with health experts, providing information that you need to get through this time. Tonight, we're addressing a growing issue, the emotional impact of the pandemic. We've been away from friends and family, and children have been apart from their schools as well, since school went remote. And the beauty of technology, I'm hearing it back on my phone. Loved ones celebrated life's joys and sadness without family by their side, and we haven't been able to hug. Stress, anxiety, fear, sadness, and loneliness, they've all increased, along with depression and substance abuse. There are more reports of domestic violence. And don't forget those on the front lines and the healthcare providers who battled to keep patients alive while worrying about the health of their loved ones and themselves. So how do we recognize emotional trouble is brewing? How do we cope? How do we stay healthy? We're going to address all this and more, and we encourage you to share your questions to be answered by our panel. So let's get to it, and welcome Dr. Vanessa Bobb, Behavioral Health Medical Director at CDPHP. Also with us is Dr. Sarah Kyriakos, Statewide Director of Psychology Services for the State Office of Mental Health, and Dr. Gerard Florio, Clinical Health Psychologist at Glens Falls Hospital, and he rounds out our panel. Welcome to all of you. And I want to start a sort of broad brush stroke because I've already had a lot of questions on this about seniors who are living in congregate settings and have not been able to be with their loved ones. And the mental health issues there, how do we address those? How do we support those folks? An awful lot to get started with. Who wants to dive right in?
Okay, I'll start. Once again, hi, I'm Dr. Vanessa Bobb from CDPHP. One of the ways that seniors can stay connected is actually a way that all of us have been staying connected these days, and that's through telephone, internet, and then also there are going to be other people within the facility where the seniors are, so if they can continue to do some of the activities. There's staff that are paying close attention to the seniors who are there. At this time, some of the things that a lot of grandmas and grandpas like are when their grandchildren draw them pictures or write them notes just to let them know how they're doing. And care packages go both ways, so our seniors enjoy those as well.
I see all of you nodding in agreement. I've got friends who have stood outside windows to talk to their loved ones. Sometimes the facility frowns on that, but does that help or does that hurt when you can do that because you still have that wall between you?
Oh yeah, definitely. In any kind of connection, the more dimensions that you can bring in, the audio, the video. Yeah, I've seen the things set up where, even with a barrier, you're trying to put your hands next to each other. All of those things make a difference. If you can record messages or record videos, that makes a big difference. And one of the things that I would want to add to what Dr. Bobb said is that not only, giving to seniors, but letting them have the chance to give back to you. Being able to contribute makes a big difference. So if you're a parent, can you set it up so that your loved one who's in a congregate care facility, a nursing home, gives you a little break by doing a little bit of storytelling on FaceTime? So the senior citizen, the grandparent feels like they are really doing something for you, and that's a big support to mental health to feel like you're giving back as well.
Because there's been much written about these seniors who are dying of loneliness. And are they? Is it the loneliness? I'm not making light of this at all. Is it underlying issues, or is the loneliness accelerating underlying issues and leading to death?
Well, there are studies around the world, epidemiological studies, that show that loneliness is as predictive of death as smoking, high blood pressure, high cholesterol. And so, the mechanism, whether they accelerate or whether they contribute, independently, we're really unsure about that. Mm-hmm. But we do know that loneliness is accelerating all kinds of things. And I think, too, some of the things that, with going out and reaching out to people, it's the effort too. It shows that, you know, I not only care enough to call, I care enough to come down. You're important enough that I come down. And so it's not only, you know, what you do in the visit, it's that you've come down and made that, you know, made that effort.
I've also had some questions tangential to that for the children of the seniors, the guilt that they feel, the heartache that they feel, that begins to add to their depression and anxiety. So share with us some thoughts on how to deal with that.
One of the things that I've done clinically throughout this pandemic is talk to people about adjusting your expectations. We are not in normal times. We are not able to do all the things that we want to do. And one of the key coping strategies for getting through this is to adjust expectations. I mean, we feel guilty when our behavior doesn't meet our expectation. And so, you know, either we change our behavior or we change our expectation. And this is an instance where we have to really adjust to the realities of what we can and cannot do.
Mm-hmm. The isolation, repeatedly, I see this in the comments from friends, some friends that I have talked to who don't have a life partner, and they are isolated, plain and simple. They're of a certain age, or they have a health condition, or they're just afraid. So now they're isolated. They don't have anyone coming into their lives. And the contention is that Zooming, FaceTime, has run its course. So help us with a prescription there, because this is not done yet.
So I think, oh, okay, now go ahead, Sarah.
You know, I think this does, it makes so much sense, right? We're almost a year in. Yeah, everybody's sick of these videos. Everybody wants to be next to people, especially if you are isolated, especially if you don't have someone that you're living with day to day. And this is where, you know, thinking about, can you be a little bit creative about some of those kind of old school things? Can you go back to letters? Can you do postcards? You know, can you contribute to a community project? Maybe it's, you're not doing it at the same time as other people, but, you know, when at the beginning of the pandemic, people were doing those rainbows all over the place. That's the kind of thing that you did. And, you know, half an hour later, somebody came by and they added to that. And that led to that feeling of connection, even though you weren't right next to them. And so it is about acknowledging, yes, the videos maybe have run some of their course, staying open to it, but also thinking about other ways to connect.
Dr. Bob, how do you, please go ahead.
I'm going to add to that, just in terms of, you know, each person has their own individual risk in terms of their medical, in terms of their work style, et cetera. So depending on the vulnerability of that individual, there are ways to socialize safely, or at least to mitigate the risk. So one of the things are, you know, so if they do want to get together, you can wear masks. If I have a mask and my friend has a mask, and we can try to maintain a good social distance, that is one of the things that will make that encounter a bit safer. Outdoor activities, so that also mitigates the risk of transmission. If you are together inside of a home, same thing, separating, but if you open the windows to have increased ventilation, those are other factors. Washing your hands, hand sanitizer. So there are ways, depending, you know, if you're immunocompromised, those are things that where you may want to isolate a bit more. The other thing I really want to encourage everyone to do, and if they're eligible, and if they are in one of the high-risk groups, is to get vaccinated. So for our folks who are elderly, if to get on the vaccine list, and then gets vaccinated once that's ready. And then also on February 14th, it's opening up to people with comorbidities. So that would include things like obesity, lung disease, heart disease. So there are going to be a lot more people who are able to actually get the vaccine. And one of the other things that came up earlier that you mentioned was, I think Dr. Coast mentioned it, and it was with how people can give back. So one of the things that our seniors actually have done is they've lived through all kinds of things. You know, some folks so the depression in some cases, and other challenges throughout their entire lives. So they might also have some coping skills, some stories of other challenges that they've gone through. They can share with their family members, friends, and the youth.
How do we help children? And how do we recognize? Probably the first question is, how do we recognize when the children are struggling because of all this?
I'm sorry. So that was an open question.
Yes, another question.
Okay.
I'm watching the clock tick down. I got a lot of area to cover. So how do we help? You know, there are so many kids who are home. What things should we be looking for in their language, in their affect, in how they are interacting at home to know whether or not this has really become a problem for them?
Well, one of the things that's a very reliable indicator of distress in kids is a change. You know, a change in behavior, a change in personality, a change in, a change in mood. You know, one of the things I'm seeing now as we're almost a year into this is that people are starting to withdraw. You know, they're starting to, even some things that they could do, they're shying away from. You know, they're kind of adding to the isolation of the, that we're already feeling. So, looking for things like that. Some kids are crying more. Some kids are complaining of more somatic complaints, especially younger kids who don't have that language to express emotion. So those are some of the things to,
Dr. Florio, let me jump in and ask, if you're seeing this and you're living with this with your child, how do you help them?
Well, I think one of the things you want to do is you want to try to engage them in a conversation. You want to try to get them talking, and you want to listen to them. You want to try to encourage, engagement, creative activity. Try to play with them. Talk to them about, how can we make this day better? Try to put some structure and routine, and then celebrate the things they do. Kids have lost a lot of opportunity for mastery. Being with their friends, being in school, they do things well, and that builds their self-confidence. They build their self-esteem. So, really celebrating them now, I think, can be a helpful.
Dr. Florio, if I could add to, when you're in that conversation, there's some things that you want to try to stay away from doing as well. So like Dr. Florio said, you want to try to engage, you want to keep those lines open. You want to try not to reassure too much, right? When a kid says to you that they're struggling, you saying, you know what, it's all okay, you're going to be fine. That really feels totally invalidating. You want to try not to problem solve so much. You don't want to jump right into, this is what we're going to do, this is how we're going to figure this out. When they actually open up to you and say, this is hard for me, what you want to do is sit with them. This is hard. I see you. I'm here for you. I can manage that this is hard for you. And the best thing that you as a parent can do for yourself and for your kid, bring some other people in. Bring some other people in. Over this year, you're a good parent, but this year, you've had to be a parent, you've had to be a teacher, you've had to be a soccer coach, you've had to be a Sunday school teacher. I mean, this is none of us were meant for this, right? You need some other people on your team, and your kid probably needs some other people to talk to. A lot of kids who feel depressed feel like they're a burden, and if they see that you're stressed, they don't want to add to your stress sometimes by telling you how they're feeling. And in those cases, one of the things you can really do is bring some other folks in, whether it could be an older cousin, could be a pastor from your church, it could be a teacher they connected with before, it could be a mental health professional, like a social worker, a psychologist, a psychiatrist, a pediatrician. But bring someone else in and open a couple of lines of communication so that your child has a number of places to go without feeling like they're a burden.
And then there's the problem of domestic violence. And people are home together, and their relationship may have been challenged to begin with, and now it is moved over into one that's not safe. But where do you go? Let's talk a little bit about people in that situation. How do we help them? How can they be helped?
Yeah, absolutely. It's a scary situation, and we know with the financial stresses, especially with the emotional stresses that are going on, we are seeing those spikes. In New York State, the Office for the Prevention of Domestic Violence runs a 24-hour chat line, call line, and that is a place where you can get immediate resources and information and referrals to help you get to immediate safety or to help you develop a longer-term plan. And that's a place where you can just call and get a little bit of help, and you can call back later and you can know there's going to be someone on the line who understands.
Mm-hmm. Because it's difficult to leave this situation now.
Very difficult.
Absolutely.
Yeah, the opportunities to potentially connect and talk to someone are being reduced by all of the isolation. And so if there are people that, that you're worried about, just check in on them a little, with some regularity of, just a social check-in, giving them the opportunity to, to maybe open up.
And while we're on in that vein, how do we're separated from everybody, and how do I know if, my friend down the street who maybe sort of indicated life wasn't great before or maybe didn't, how do I reach out? What can I do to help a family member or a friend? Is there something, as we're socially distant, that we can do to help?
So depending on the particular situation, if this is a friend that you know well, you can just give them a call and say, hey, let's go forward, let's do some exercise, and see if they're actually allowed out the house. And in that kind of context, you can still maintain a distance and still support each other and be able to kind of get a little bit more of a sense of what's happening in terms of looking at that person, or if they're even maybe a sibling or something. And it may take some time for them to actually be able to confide. The other thing is that they may not feel comfortable due to stigma, shame, etc. Just letting them know that there are these phone numbers, as well as particularly we're here at Capital District Physician Health Plan, where we've got a behavioral health intake line, and it's on the back of every CDPHP card. So if you just call up and you look at mental health services, we've got an access line where we've got folks that can help connect with all kinds of services, whether that be connecting with case management around food, domestic violence. We can connect with individual mental health. Also, if it does seem like, because some people live in apartment buildings, or they may hear the neighbors, and if there's kids involved, they can also, if it really does sound like it might be dangerous, they can also call children's services that can help with putting in protective services to help the entire family.
There's also the issue, and I know we're flying through all this, of substance abuse. And somebody who is in that situation knows that they're struggling. But we're also seeing it with, and we've seen the sort of the jokes about it. You're having wine at 4 and 5 and 6, and your sweats, and it's getting you through the day. At what point is this a problem?
Well, I think it becomes a problem when it starts to interfere with people's functioning, their social functioning, their occupational functioning, their personal functioning. It becomes a problem when it becomes the major way that you cope. Anytime you are reliant in a major way on something outside of you, you're vulnerable. And you're developing a dependency. Mm-hmm. So, when it becomes something we're relying on, and when it starts to interfere with functioning, you're moving now more towards something that needs to be addressed.
Mm-hmm. and get on it then. One of the questions came in from somebody who has dealing with depression. They are a COVID long hauler. I see you nodding, Dr. Kyriakos. Let's talk a little bit about that and how to help, and where you have to seek help.
Yeah, and so, you know, a COVID long hauler is someone who's had COVID and then, you know, maybe for weeks or months afterwards is experiencing symptoms like shortness of breath or some pain. And, you know, one of the things that we know is that, you know, there are certain categories of folks who are at really high risk for some of these mental health effects. Those include, you know, people who've lost loved ones, people who've lost a job, healthcare workers, and one of the categories is people who are survivors of COVID-19 infection. And so that is one thing to know, that you know, you're in a category where you need to be taken care of, and you need to be looking out for your mental health because you are at that high risk. One of the things, you know, if this is something that's accessible to you and interesting to you, there are a lot of online groups for COVID long haulers. And folks have said that has made a really big difference to have that social support. In any of those groups, those high-risk groups, social support is one of the best things that you can do, to be surrounded by people who get it, who you don't have to kind of explain the whole thing to. And that doesn't mean that sitting around and talking about how hard it is or the trauma that you've been through is necessarily a good idea, but just to be in that place where you are with people who know where you're at and can support you to draw on the coping skills that you have, because you have been through something hard. You have been through something hard. That means that you've pulled on your coping skills and your resilience already, and it is about accessing that and moving forwed.
Yeah. I've got a question from...
Go ahead, I just wanted to add to that in terms of telehealth. Just wanted to make a big plug for telehealth.
Definitely.
So, you know, within COVID, there have a lot of bad things that go along with it, but one of the positives is the increased uptake of telemedicine, particularly telemental health. So, and for someone who might still be having additional physical symptoms where it might be hard to get out and actually see a therapist, being able to connect with a therapist online or a psychiatrist online for either therapy or medication management, that is just a way that opens up access. So in the capital area, we did have some limitations on capacity, but with telemedicine, that opens up a lot of providers from throughout the greater New York area.
And people need to know insurance does cover it. I've got a question from Julie that COVID has messed up her sleep cycle. So she's never, you know, in this case, it's a particular problem. She wants to be awake in time to get out to get, you know, food, get to a food pantry. And it's neat. The community is already providing help for her. But the sleep cycle, this is common. How do we deal with this? How do we begin to address that?
One of the things that can be helpful, one of the big reasons for disrupted sleep is just disrupted routine. Everybody's sense of structure and routine has been changed, and so getting a structure into your day can not only help to buffer some of the effects of stress, but it can also help to return back to a good sleep-wake cycle. There are some good sleep hygiene type interventions where you can talk to, you can also do it through telehealth. You can talk to someone about what are the particulars of your pattern when it was working well. How has it devolved into what it is now? How do we move behaviorally back to those good patterns?
There's an organization called CERMO. It's a physicians' online community, and they surveyed their physicians, and 86% of doctors believe that mental health issues, depression, will be the biggest non-COVID-19 issue as a result of the pandemic. This is not going away when transmission stops. This will be the holdover. So how are we as a community set to deal with this? I know we've got the telehealth, but what things should we be recognizing in ourselves and in our loved ones so that we get the help?
Yeah, for sure. And one of the things to know is that, with any kind of disaster, this is a particular kind of global pandemic, once in a century kind of thing, but whether it's a terrorist attack or a hurricane or whatever it is, the psychological impacts are much longer lasting and have a much greater footprint than the physical impact ever does. And so the pandemic is similar to other disasters in that way. And that means that what we know about other disasters can help us as we plan for the future. One of the big things to know is that, yes, we do expect that many people will have longer term mental health effects. At the same time, if you're sitting at home and you're thinking, oh my gosh, what's it going to be like? I also want you to know, I think we all would want you to know, it's normal to have these reactions in abnormal times. It is normal to feel stressed. It is normal to feel anxious. It is normal to feel overwhelmed. And the vast majority of people will be able to go back to their normal functioning. And to have that hope in your mind is really important. You have to be able to identify, the signs of when things are going wrong, but you also need to know that with a little bit of support, you are going to be able to call on your community, your social support, your coping strategies. One of the things that I wanted to highlight is that the Office of Mental Health has an emotional support helpline that runs 8 a.m. to 10 p.m. every day. We set it up at the direction of the governor. It's funded by FEMA, and trained crisis counselors have answered over 50,000 calls. You can get the number at nyprojecthope.org. And it really is people who can let you know, hey, what you're feeling right now, that's what would be expected. Or what you're telling me you're feeling right now, that's something that you might need a little bit more help with.
And then we've got about a minute to go, and then there's the whole issue of supporting the healthcare professionals who have been through so much. Do they bounce back? How do we help them? I mean, we're talking PTSD.
I think that's a really good point, Benita, and that's something we're not seeing yet, but healthcare professionals are being asked to go above and beyond in terms of risk and hours, and they are also having to fill roles that family used to. I mean, I've talked to healthcare professionals who have sat days in a row with people who are dying and their loved ones are not there, and they're delivering amazing, compassionate care, but it takes, it can take a toll. And so I think that we have to be aware of the potential for that. Most people will be able to return to normal functioning. Some people show post-traumatic growth, but some people will suffer from PTSD. And I think hospital administrators, needs to be aware of that. Families need to be aware of that too.
You've all got your work cut out for you, and you've really provided so much insight for everyone this evening. So many thanks again to our panel, Dr. Vanessa Bobb, Dr. Sarah Kyriakos, and Dr. Gerard Florio. And thank you for spending time with us. We do have a number of mental health support services on the link section of our website at WNYT.com. Stay well, stay in touch with each other, and stay well. I don't know if you can all hear me.
Yes.
Thank you so very much. We flew through, we covered so much. You were wonderful. You also